Welcome back. Well, in the first half of the show, we spoke to former Shadow Emergencies Minister Chris Williamson, who called for the nationalisation of the pharmaceutical industry. I'm joined now by the director of NGO Global Justice Now, Nick Dearden. Their report, Pills and Profits, looks at whether drug companies are making a killing out of public research. Nick, thanks for coming back on the show. Before we get to what Chris Williamson was talking about, tell me about this report.
Well, essentially, I mean, people have known for a long time that the pharmaceutical industry is completely dysfunctional. If what you want out of that industry is important medicines to be researched at the lowest price that we can research them.
Well, not everyone would say that at all, actually.
Well, maybe not, but I think that the pharmaceutical industry has had a very bad rap historically, and it's fully deserved it. And so we thought that we'd look into what the situation was now, especially bearing in mind all of the news headlines we've had about the NHS winter crisis and so on. And of course, a lot of that is to do with underinvestment in the NHS, but some of it is actually to do with the amount of money the NHS is paying for medicines. Often paying big pharmaceutical companies, British, Swiss and American pharmaceutical companies, who are massively overinflating the price of their medicines
because they can. We've got the latest figures of winter death. It's a testament to pharmaceutical company research that they have new drugs, and of course they're going to, I think they've risen in price to the NHS by a third in 5 years, because that's a testament to how good they are.
Well, that's an interesting statistic you've got there. So 29% rise in 5 years of the amount of money, just a rise in the amount of money the NHS pays for its medicines. That's the same amount of money, more than the amount of money that the NHS deficit comes to. So a very, very large amount of money for the NHS. Now you can say, well, they're producing important drugs. Of course, fine. The problem is twofold. First of all, many of those drugs have actually been researched with our money, with taxpayers' money. The government hands over money, and we use our university system to research. We do some of the best research in the world, researching new medicines that are vital for saving lives and reducing suffering. And yet we put no conditions on that money that we give to the pharmaceutical industry, ultimately, because they're the ones that develop the drugs. And so they can end up charging whatever they want, essentially whatever the market will stand. And we know this because we've got a couple of examples. So you look at one drug that was made, it treated leukemia, but it also treated and was very effective in treating multiple sclerosis. Now, when the pharmaceutical company concerned find out about this, they reissued the drug for MS, for multiple sclerosis. And they thought, we can charge way more for this than we could for leukemia because the market will stand it. And the price rose from something like £2,500 for one treatment to £55,000. It rose 22-fold for no other reason than the market will accommodate that. And what that means is, first of all, you're not getting drugs research that we desperately need because there's no profit in it.
Well, you seem to be arguing that we should be cutting the R&D.
I'm arguing we should...
I mean, last week we had a show about subsidising the arms industry. In effect, we're subsidising the pharmaceutical industry, but to try and save lives, surely.
But if we're subsidising it, let's put conditions on those subsidies, or even better, let's run it in a public way.
Why do you think the government doesn't impose conditions, given with all this taxpayer money slushing around?
I think it's very similar to... It's like what you've just said about the arms industry. Many people say we don't have an industrial policy in this country. Actually, I think we do have an industrial policy. We subsidise and support the arms industry, and we subsidise and support the pharmaceutical industry via the money we give for research and development and through the NHS. And what it means is now we're at a stage where really vital medicines that we all need because our entire medical knowledge depends on them, like antibiotics, haven't been researched properly because the pharmaceutical companies say we don't want to go near that because there's not enough money to be made. At the end of the day, we don't want a fallback antibiotic that almost no one's going to buy until it comes out of its monopoly status, until it loses its patent, because we can't make any money on that.
But your report admits that the UK is the second largest subsidiser of R&D, and it's in the developing world. We're helping the developing world with this research.
Sometimes, yes. But if we really want to help, get those people who desperately need these drugs access to these drugs, we need to control the prices that are charged. And that's what we don't do at the moment. We have no control over the pharmaceutical industry. We say, yes, it would be lovely to research these drugs. We give subsidies for it. Sometimes the pharmaceutical industry takes that up. But at the end of the day, if you don't have any control over how those drugs are going to be marketed and what's going to be charged for them, the people who most need them won't be able to get them.
But if you're a big pharmaceutical company, having been subsidised on a particular medicine by the British taxpayer, you're not going to want to price itself so that it won't be available on the NHS.
You would think so. However, we see time and time and time again the NHS, through NICE, the body that recommends is this affordable or not, is this effective or not?
Excellence.
That's right. Saying we can't recommend this at this time because it's just too expensive.
Even though the British taxpayer subsidised the research in the first place.
Exactly.
You have proof of this?
Yes. So some of the very drugs that we have researched, especially in their early stages, and of course that's where most of the risk comes from. I mean, this is an old story, isn't it? The public sector supports the most risky phases of development at an early stage. The pharmaceutical companies take that research and they go on and market it and patent it, and so they can charge what they want at the later stages when it's less risky. So if you look globally, the early stages of research, about 2/3 of the money comes from public institutions. So great, but what we then do is give those drugs, that medical knowledge, to people who essentially have monopoly over those drugs for the next 20 years.
They obviously patent the drugs.
They patent it, and that's core to what's wrong with the whole system. Look, we hear all sorts about the wonders of the free market and competition and so on. But actually, here you have an industry where you're not talking about the free market or competition at all. You're talking about an old-fashioned private monopoly, which, through international trade laws, refuses to tolerate any competition. So essentially, for 20 years, they can do what they want.
Would you admit, though, that our lawmakers, our politicians need to be hanging out with big pharmaceutical company bigwigs to keep an eye on them? Is that what they're doing when they're having dinner with top pharmaceutical company bosses?
My fear is that there's a real parallel you can draw here between the pharmaceutical industry and the financial sector, where politicians, of course, say this is a really important sector for our economy, but unfortunately, they don't therefore say we need to regulate it, tax it, and make sure it works in the public interest.
Your report claims that the people from the pharmaceutical industry are given preferential places on research boards in this country.
Exactly so. The whole way the system works, including how effective a drug is, you do not have to have proper transparency and accountability for the way you do that research. So pharmaceutical companies don't have to release research that proves their drugs aren't effective. They only have to release the research that proves they are effective. So the whole system from top to bottom has been created in the interests of pharmaceutical corporations. And when politicians meet with them and stay close to them, I fear they're not keeping an eye on them and trying to control them. What they're actually doing is, it works the other way around. They're actually taking their instructions and taking their orders from them. And of course, pharmaceutical companies, as we saw with the banks 10 years ago, are saying, if you regulate us, if you tax us, if you try and control us, we'll go somewhere else. And that's why even a very, very senior Goldman Sachs employee, Jim O'Neill, has said, if the pharmaceutical industry is not careful, in a few years' time, it's going to be in exactly the same situation the banks are in today, with huge public contempt and hatred for the fact that they have destroyed the medical knowledge of the last 100 years, 70 years, 50 years, through their monopoly status and through driving for ever higher profits rather than trying to do something to improve ordinary people's lives.
You don't go so far as Chris Williamson, who said that well, your report says they're de facto nationalised anyway, or at least the losses. You don't go as far as the British Labour Party. Some members of it, that it should be nationalised.
I'm happy to go that far. I'm happy to say it should be nationalised, but actually I think it's a bigger issue than just looking at old-fashioned nationalisation. For example, yeah, OK, the government might take over a pharmaceutical company, but I don't really care if the government is involved in researching and marketing suntan lotion, for example. What I want is the essential medical knowledge that we all rely on to be held in common at a global level. I mean, this is knowledge that if we're to advance our societies, if we're to actually create more equal societies where people don't suffer unnecessarily, as they do in their millions today, this knowledge needs to be open to all. And that means not just the British government, it means we need to find a completely different way of doing this research and development. And I hope for those governments that read this in the South, because, you know, there have been governments over the years that have taken on the pharmaceutical companies at great cost, the Indian government, especially the South African government over the years. I hope that this gives them a little bit of ammunition to say, actually, there's no reason at all why we can't just make exceptions to trade law, as they're allowed to do, and simply license these drugs for local generic production.
Just briefly, until we get to that stage, what is someone supposed to do if they're in a Western European and the United States, if private health insurers offering them cheaper drugs than they should be, less proven, efficient drugs, say here on the National Health Service, being given a drug, you can Google them now. Yeah. What are they supposed to do when they know they're being given drugs that aren't as modern as they should be?
Campaign. This is a political issue, and we need political change. There's a great organisation we've been working with called Just Treatment, which takes patients who've had to crowdsource for their own drugs so that they can receive treatment for cancer and so on, because the NHS can't afford these drugs. They need to campaign and put pressure on. And we all know that the press is interested in people who are suffering unnecessarily when the NHS is unable to provide because of the high prices charged by the pharmaceutical companies. So I think this one's got real legs, and we see progress in it. What I'd like to see a government doing is saying, actually, this drug is so essential. And by the way, we helped to fund and the research for this drug, say, essentially do the same as India and South Africa have done in the past. Say, we don't recognise this monopoly, this is too much of an emergency, issue a compulsory licence and issue generic production. That would give the pharmaceutical industry some pause for thought.
Nick Dearden, thank you.